The title of my capstone study is Patterns of Stuttering in a Mandarin-English Bilingual, a Case Study. It is by myself, Yahui Lin. So why did I choose this topic? According to Guitar, stuttering occurs across cultures, languages, and races. It affects both monolingual and bilingual speakers. And according to Gordon, Mandarin is the most widely spoken language in the world, with more than 1 billion speakers. In the United States, according to Ryan's data, Mandarin is the third most common spoken language. And also statistics show that increasingly more and more people have started to speak Mandarin in the United States over the past 3 decades, with 345% change. Even though this is the case, little research has been done to investigate stuttering in Mandarin English bilinguals, so that's why I chose this topic. So I reviewed 2 articles in my capstone, well 3, but in this PowerPoint I will just review 2 of them. So one was done by Ardila and others. They had a case study of a Spanish-English male bilingual who stutters. They explained the similarities and differences in this subject stuttering pattern. So what they did was they administered 8 assessments to the subject in both languages, English and Spanish, in a single session. These assessments include spontaneous speech test 1 and 2, reading, Boston naming test, verbal fluency tests, language repetition test, Peabody picture vocabulary test, and also the vocabulary subtest from the Wechsler Adult Intelligence Scale. So what they found was there were both similarities and differences observed in the stuttering pattern. More specifically, stuttering was observed more in spontaneous speech and conversations in both languages, and less in other speech situations, such as the vocabulary test, the naming test, and the verbal fluency test. Also, stuttering occurred more frequently in adjectives, adverbs, verbs, and also conjunctions in Spanish compared to English. Overall, stuttering was more severe and frequently found in the less dominant language, in this case, Spanish. So the strengths of their study, they had a thorough analysis of the subject's stuttering pattern, including they have used standardized assessment tests, T-units, and also index of phonetic complexity. So even though they had a lot of strengths in their study, they had some limitations. They failed to point out the clinical implication the study provided. Also, they did not consider individuals' affective and cognitive aspects of stuttering, which is very important, which is also the holistic picture of the stuttering. So another article I reviewed was from Lim and others. In their study, they examined the severity and the types of stuttering in bilinguals who speak Mandarin and English. They also analyzed the relationship between stuttering and language dominance. So what they did was they recruited 30 participants to the Singapore General Hospital Stuttering Clinic, and they had the participants come to the clinics twice. During the first clinic visit, they collected case history, they did initial interviews, and also they administered self-report classification test. This self-report classification tool was used to divide participants into one of the 3 language dominance groups: the balanced bilinguals, the English dominant, and the Mandarin dominant. Also, they obtained speech samples in both Spanish and, in Mandarin and English. And between the first visit and the second visit, they also had volunteers to do the telephone conversations with the participants, and also they obtained audio recording samples. So during the second clinic visit, the participants completed the MBPVS, which is the Multilingual British Picture Vocabulary Scale. This is the British equivalent to the Peabody Picture Vocabulary Test. So the results were that the types of stuttering were not significantly different across languages. Also, language dominance was found to influence stuttering severity. More specifically, bilinguals who stutter were found to stutter more frequently in the language that was less dominant. So one of their strengths was they considered many interactions among many factors, including settings, listeners, and conditions when evaluating the participants' stuttering behaviors. Also, their reliability analysis was very rigorous. The researchers were able to control the extraneous variables to ensure the reliability of the research. One of their weaknesses was they had very small sample size in the Mandarin-dominated group, where there were only 4 participants, whereas in the English-dominant group, there were 15 participants, and in the balanced bilingual group, there were 11 participants. So this unbalance of the speech sample size will definitely affect the results. Also, just as the first study did, they also failed to examine the affective and the cognitive aspects of stuttering. So in my study, the purpose is to compare stuttering patterns in a Mandarin and English-speaking individual, and also to analyze the affective and cognitive components of his stuttering, including feelings, emotions, thoughts towards stuttering. So what I did was, first of all, the participant is a 24-year-old Mandarin English bilingual male whose dominant language is Mandarin. According to him and his mother, the onset of stuttering was around 8 years of age, and he has been receiving therapies in the UNCG's speech and hearing clinic for, I think, almost 2 years now. So in the study, a series of speech, language, and quality of life tests were administered in both Mandarin and English in one single session. These tests included spontaneous speech sample 1, where the participant had to describe the picture from Boston Diagnostic Facial Examination Test. And in the spontaneous speech sample 2, the participant had to report something about his major, such as the courses, the paper, the presentation, and something like that. Also, reading was included in the speech sample, and Mandarin and English passages were in a similar topic and similar level of difficulty. We also administered verbal fluency tests and stuttering severity instrument tests, the OASIS, which was about the emotions, the feelings and thoughts about the participant, and also the Erickson communication attitude scale. So in my study, the research questions were, does stuttering occur more frequently in the less dominant language? And the second one was, does lexical tone in Mandarin have an effect in stuttering loci? The third one was, does the subject's experience in 2 different cultures account for different affection and cognition of stuttering? So based on these 3 research questions, hopefully I can find out the holistic picture of the individual's stuttering. And these are the references of my article. Thank you.